I'm going to guide you through a basic diaphragmatic breathing practice. Although this is a very simple practice, please listen to your body whilst doing it and stop if you need to. Sit comfortably in your chair with your back fully supported and both of your feet flat on the floor. Inhaling, lift the crown of your head towards the ceiling, lengthening through your spine. Exhaling, allow your shoulders to soften and release into the support of the chair. We are going to be taking our awareness inside our bodies for this practice, so it can be helpful to close your eyes. If you're experiencing a lot of anxiety today, just keep them downcast so that you are shutting out any distractions. Now bring your awareness to the surfaces that are supporting you and notice what this feels like. Really feel your feet on the floor and your body supported by the chair. If you can, try to breathe in and out through your nose as we do this practice. Place one hand on your stomach and one on your chest. Inhale slowly and deeply through your nose, and then with lips pursed, exhale slowly through your mouth. Notice which hand moves the most as you breathe in and out. Ideally, you want the hand on your stomach to move the most. This would signal that you are using your diaphragm for breathing. If both hands move, or if the hand on your chest moves the most, it means you are using your neck, chest, and upper back muscles, your accessory muscles. Now place both of your hands on your stomach with your index fingertips touching. Inhale slowly through your nose, bringing your breath down the back of your throat, into the chest and down to the stomach area where your hands are placed. Allow your stomach to expand as you bring breath into this area. Exhaling slowly through pursed lips, allow the air to come out of your stomach, up to the chest, through the throat and out the mouth, gently drawing your stomach inwards at the very end of the exhale. Don't worry if this feels hard at first. If you're not used to breathing this way, it can take time. Now place your hands on the sides of your lower ribs. As you inhale, bring your breath into your stomach area, and with an extra sip of air, bring it up into the lower rib area as well. You may feel the ribs push against your hands as you do this. Exhaling, release the air, gently drawing your stomach inwards at the very end of the exhale. Finally, to explore using your full lung capacity, place your fingertips on your clavicle bones just below your neck. Inhale into the belly. Extra sip of air, bring the breath up to the lower rib area. Taking a further sip of air, bring it as high up as you can. You might sense that your hand or elbow moves a little as you do this. Exhaling, release the air, gently drawing your stomach inwards at the very end of the exhale. Taking your hands back down to your thighs, palms facing up, continue breathing into and out of all three parts of the lungs for a couple of minutes. If you feel as though this is putting too much strain on your breathing, reduce it to just the stomach area. You are looking to feel as though you are stretching your breath with some slight strain, but not to the point that you are out of breath. You might notice that you start to cough. This is normal as you open the airways. Continuing to allow the navel to expand as you inhale. and drawing your stomach in at the very end of your exhale. Remembering if breathing into all three parts becomes difficult, just take the breathing down to the stomach area only. And if your mind wanders away, just bringing it back to your breathing. And now allowing your breathing to return to normal. Bring your awareness to the contact between your body and all of the surfaces that are supporting you. Inhaling, stretch your arms overhead as high as is comfortable, taking a full upper body stretch. Exhaling, bring your hands back down to your sides as you slowly start to open and close your eyes, coming back into the room. Orient to the environment around you by turning your head to look around. Take a few moments to notice how you are feeling. At home, begin practicing this lying down. Once you are comfortable with the practice, you can do it whilst seated or standing. Just ensure that you are keeping your shoulders, head, and neck relaxed. It can also be helpful to do this practice lying on your side. Just make sure that you do the same length of time on each side. Do the practice for 5 to 10 minutes at a time, gradually increasing as your body adapts. I would suggest making it part of your daily routine. For example, when you wake up in the morning and when you go to sleep at night. Do 3 to 4 shorter practices a day as you build up to 2 longer ones. And that concludes the breathing practice.